We all have our little quirks, right? Like, maybe you always have to have your coffee a certain way, or you get a little fidgety before a big presentation.
We've all been there.
It's totally normal to have those little things we do to manage stress. But what happens when those coping mechanisms, those little quirks, point to something a little bit deeper, something more complex?
Right, when they start to have a real impact on your life.
Exactly. And that's what we're diving into today. We're talking about the connection between OCD and alcohol use, a link that honestly a lot of people don't even realize exists.
It's a connection that's often overlooked, but incredibly important to understand.
Our listeners have been asking us to really dig into this, and what we found is that these two things, OCD and alcohol use disorder, they might seem totally separate on the surface, but they're often way more intertwined than you might think.
Yeah, and to really get why that is, it helps to take a step back and define our terms a bit. When we say OCD, we're not just talking about liking things organized or being a bit of a neat freak.
Right, it's more than just having a tidy desk.
Exactly. We're talking about obsessive-compulsive disorder, a clinical condition characterized by intrusive, unwanted thoughts. We call those obsessions. And these obsessions are often accompanied by these repetitive behaviors or compulsions that people feel driven to perform to try to neutralize the anxiety that those thoughts create.
So it's not just about like liking a clean room. It's almost like these thoughts and these urges kind of take over in a way.
Yeah, you got it. And, these obsessions and compulsions can show up in so many different ways. I mean, someone might have, say, a fear of contamination that leads to excessive hand washing, or they might have this really intense need for symmetry where like even simple everyday tasks become almost impossible to complete because everything has to be lined up perfectly.
It can be really debilitating, and I
Yeah.
think it's easy to underestimate just how much it can impact someone's life.
Absolutely. And the research we were looking at showed that over 2% of adults in the U.S. will experience OCD at some point in their lives.
Wow, so it's more common than people might realize.
It really is. And that brings us to the connection with alcohol, which is something that, well, it's pretty significant. One of the studies we looked at said that almost 24% of adults with OCD also meet the criteria for alcohol use disorder.
That's like, what, almost 1 in 4? That's a lot higher than the general population.
It's a pretty striking statistic. And while it's not a simple cause and effect relationship, one thing directly causing the other, there's a really clear reason why this link is so strong. People with OCD are often dealing with this like constant battle against anxiety. They're always looking for a break from those intrusive thoughts and urges. And alcohol can, at least initially, make them feel like they're getting a little bit of relief, like a break from the noise.
Like hitting the mute button on those thoughts for a little while.
Exactly. And it makes sense even from like a brain chemistry standpoint because alcohol initially causes this surge in serotonin, that feel-good chemical in our brains. So for a short time, those OCD symptoms might feel less intense, less overwhelming.
Okay, so there's this temporary relief, but I'm guessing it's not that simple, right? There's got to be a downside.
You're right. It's definitely not that straightforward. And this is where things start to get a bit more complicated. While alcohol might seem to help at first, the after effects actually end up making anxiety and OCD symptoms even worse over time.
It's like a double-edged sword, right? Trying to find relief, but actually making things worse.
Precisely.
Yeah.
See, as alcohol wears off, serotonin levels plummet. They actually often drop lower than they were before you even had that first drink. And that crash,
Yeah.
well, it can intensify those obsessive thoughts and compulsions, making them even harder to resist.
So it's like trying to put out a fire with gasoline. The very thing that you're using to try to find relief is actually making the problem worse.
That's a great way to put it. And as someone starts relying on alcohol more and more to cope, they become less equipped to manage their OCD without it. It's like relying on a crutch for so long that the leg it's supposed to be supporting becomes weak and unstable.
And on top of that, we haven't even gotten into the increased risk of anxiety and depression that can come along with using alcohol to cope with OCD.
It's true. Living with OCD can be incredibly draining in and of itself, right? You're constantly battling those intrusive thoughts and compulsions. And then you layer on the negative impacts of alcohol, misuse the guilt, the potential health issues, the strain it can put on relationships, and it creates this really difficult situation.
It's a lot to process, for sure. And while this is heavy stuff, I do want to acknowledge that even though this connection between OCD and alcohol use is serious, it's not hopeless. There are effective treatments available, and we're going to talk about those in a bit. But before we dive into solutions, I think it's important to really understand the risks involved, because sometimes understanding just how risky a behavior can be the thing that motivates someone to seek help, wouldn't you say?
Absolutely. Knowledge is power, and in this case, understanding the risks can be the first step toward making a positive change.
It's like they say, sometimes you have to know how bad things could get to be ready to make a change.
Right. Understanding the potential consequences can be a powerful motivator.
Absolutely. So let's talk about the risks of this connection between OCD and alcohol use. We've touched on how alcohol can intensify those OCD symptoms, but what does that actually look like in someone's day-to-day life? How does that actually play out?
Well, think about someone who's struggling with contamination fears, which is a really common OCD obsession. They might already have this routine of, say, excessive hand washing, right?
Right.
But then after drinking, that urge, that compulsion, it can become almost impossible to resist. We're talking about maybe spending hours scrubbing, even to the point of hurting themselves. It's like they get trapped in this cycle that's fueled by that alcohol-induced anxiety.
Wow, that's a really, it's a powerful image and kind of disturbing when you really think about it.
Yeah, it can be really intense.
It really highlights just how serious this connection is. And it's not just the intensity of the compulsions that increase, it's the frequency too, right? Like how often those compulsions pop up.
Exactly. Those intrusive thoughts, those urges, they can become relentless,
Yeah.
almost constant. Like they just keep popping up more and more often. And it's like they're being fueled by the very substance that the person's using to try to quiet them.
It's like trying to put out a fire with gasoline, right?
Yeah, that's a good way to put it.
What you're doing to try to find relief is actually just making the problem worse.
It's a vicious cycle, for sure. And, as someone relies more and more on alcohol to cope, they become less able to manage their OCD without it. It's like if you're relying on a crutch for too long, the leg that it's supposed to be supporting, it gets weaker. You almost forget how to walk without it.
Right, you become dependent on it.
Exactly.
And then on top of all of that, we have to add in the increased risk of anxiety and depression that comes with using alcohol to cope with OCD. It's like this ripple effect that impacts so many areas of someone's life.
Absolutely. I mean, just living with OCD in itself can be so draining. You're constantly battling these thoughts and these urges, and then you layer on the negative impacts of alcohol, misuse, the guilt, the potential health problems, the strain it puts on your relationships. It's a lot. It creates this environment where anxiety and depression can really take hold.
Yeah, it can feel really overwhelming for sure. But, and I know we'll talk about this more in a bit, there is hope. Treatment can make a huge difference for people who are struggling with this.
Absolutely. It's so important to remember that co-occurring OCD and AUD, they can be treated effectively. It might take a multifaceted approach, but recovery is definitely possible.
Okay, that's good to hear because it's easy to get caught up in all of this and feel kind of discouraged.
It's understandable, but there's definitely hope.
So let's talk solutions then. What are some ways that people can get help if they're struggling with this? What does that path forward look like?
Well, one of the most effective approaches for OCD, and it's often used for co-occurring disorders as well, is something called cognitive behavioral therapy, CBT for short.
Okay, CBT. That's something we hear a lot these days, but I think for people who don't have like a background in therapy, it can be kind of a confusing term. What does CBT actually look like in practice? Could you break that down for us a little?
Sure. So basically, a CBT helps people learn how to identify and change those negative thought patterns and behaviors that kind of fuel that cycle of OCD.
So you're kind of learning to change your relationship with those thoughts and urges rather than letting them control you.
Exactly. It's about recognizing those patterns and then developing healthier ways of responding to them. And there's one type of CBT in particular that's been shown to be super effective in treating OCD, and that's exposure and ritual prevention, or ERP.
ERP, okay. So for someone like me who learns best through examples, what does that look like in like a real life scenario?
Okay, so let's say you have someone with a fear of contamination, right? That's a pretty common one.
Right.
ERP might involve gradually exposing them to situations that trigger those fears, but in a safe and controlled environment. So for example, it might be something like having them touch a doorknob and then resisting the urge to immediately wash their hands.
Oh, wow. Okay.
So it's about gradually confronting those fears.
Yeah, that sounds really challenging, but in a good way, like you're facing those fears head on.
Exactly. And the idea behind ERP is that it helps to rewire those neural pathways in the brain so that the trigger doesn't automatically lead to the compulsion. It's like retraining your brain to respond differently.
So it's not just about like white knuckling your way through it. It's about learning these new skills to manage that anxiety.
Exactly.
That makes a lot of sense. Now, aside from therapy, we also saw in the research that medication can play a role in treatment, particularly a class of medications called SSRIs. Can you tell us more about those?
Yeah, SSRIs. So a lot of people have heard of SRIs in the context of treating depression, which they're very effective for, but they've also been found to be really helpful in managing OCD symptoms
Yeah.
and even in reducing those alcohol cravings.
So they can kind of work on both sides of this issue at the same time.
Right. It's not just about masking the symptoms. It's about addressing those underlying chemical imbalances that might be contributing to both the OCD and the urge to use alcohol as a coping mechanism. Now, of course, as with any medication, there are potential side effects. So it's crucial to have that open and honest conversation with your doctor, with your medical provider, to figure out if medication is the right choice for you.
Right. Always talk to your doctor before starting any new medication. That's important. Okay, now shifting gears a little bit here, we can't really talk about treatment for alcohol use disorder without talking about detox and rehab programs, right?
Absolutely not. Those programs are crucial. They provide a safe and structured environment for people to work through alcohol dependence and start building that solid foundation for long-term recovery. And there are different levels of care available depending on the person's needs. So you have inpatient programs where someone actually lives at the facility while they're receiving treatment. And then you have outpatient programs that offer more flexibility for people who are able to, continue with their day-to-day lives while they're attending therapy sessions.
So there are options out there depending on what someone's individual needs are.
Exactly. There are different pathways to recovery.
Okay, so we've talked a lot about how alcohol can amplify those OCD symptoms, but I think it would be helpful to really illustrate this connection with some more specific examples of different types of obsessions and compulsions and how they might show up in someone's life if they're also using alcohol to cope.
Yeah, I think that's a great idea. Sometimes hearing those concrete examples can really help to kind of connect the dots. So um, let's go back to that example of contamination fears for a minute. We're talking about how someone with that obsession might already be prone to things like excessive showering or changing clothes multiple times a day. Now imagine them trying to manage that anxiety with alcohol on top of it.
Right. Yeah, that does not sound like a good combination.
No, not at all. What might have started as a somewhat manageable routine can quickly spiral into this really intense, all-consuming obsession.
Right. It's like it's already hard enough to manage those compulsions when you're sober.
Exactly.
Yeah.
Exactly. And then you add alcohol into the mix, and it's like, forget about it. Someone might find themselves staying up all night, scrubbing their skin raw, just trapped in this loop of fear and alcohol-fueled paranoia.
It's like those compulsions almost have more power over you when you're under the influence.
Yeah, it can feel that way. And that's why it's so important to really address both issues, the OCD and the alcohol use together.
Right. You can't just focus on one and ignore the other.
Exactly. Okay, so we've talked about contamination fears. What are some other types of obsessions that someone might use alcohol to cope with? Well, intrusive thoughts are a big one.
Intrusive thoughts. Okay.
Yeah, these are those really unwanted, often disturbing thoughts that just kind of pop into a person's mind, even though they really don't want them to.
Oh, yeah. I've definitely experienced that before. It's like, where did that come from?
Right. And it can be really jarring. And with OCD, these thoughts can be anything from fears of harming themselves or others to, religious obsessions or sexual obsessions that cause a lot of shame and distress.
That sounds incredibly difficult to deal with. Like, just the thought of having those kinds of thoughts constantly popping into your head, it would be so hard to function.
It's a constant battle. And I can see why someone might be tempted to reach for alcohol to try and quiet those thoughts, even if it's just for a little while.
Yeah, just to get a break from them.
Ex-
But like we were talking about earlier, it seems like alcohol usually ends up having the opposite effect in the long run.
It really does. Alcohol lowers your inhibitions, right? So it actually makes it even harder to push back against those intrusive thoughts. It can create this sense that those thoughts are kind of taking over, and that can lead to even more anxiety and distress, which just fuels that urge to drink more, to numb the pain, and so on and so on.
It's like a vicious cycle.
It really is. And it highlights just how important it is to reach out for professional help, because breaking free from that cycle often requires learning new tools and strategies to manage those thoughts and urges.
And that's where therapy, medication, those kinds of things can really come into play.
Exactly. Okay, so we've covered contamination fears, intrusive thoughts. What about that need for order and symmetry that we see in some people with OCD? How does alcohol play into that?
Yeah, that's another one that I was curious about because I think a lot of people relate to that need for things to be just so. But with OCD, it's obviously a lot more extreme.
Right. It goes way beyond just liking a tidy house.
Hmm.
It can be really debilitating. So, okay, picture this. You have someone who feels this intense compulsion to have everything in their home meticulously arranged. And we're not just talking about, straightening up a bit. We're talking about maybe spending hours each day straightening picture frames, aligning objects perfectly, like unable to relax or focus on anything else unless everything is just so in their environment.
I can already feel my anxiety going up just thinking about that.
Right. And then you add alcohol into the mix.
It seems like it would just amplify everything.
Exactly. And here's the thing. Alcohol, it disrupts your executive function, which is that part of the brain that's responsible for planning and self-control, right? So it impairs your judgment, and it makes it even harder for someone with OCD to recognize when their behaviors are becoming problematic.
So it's not even just that the compulsions themselves become more intense, it's that you might not even realize that they're becoming a bigger problem.
Exactly. That's such a good point. It's like the alcohol is kind of clouding your ability to see things
And
clearly.
that all of your filters are off.
Yes, exactly. And that's why understanding this connection, this link between OCD and alcohol use, it's so crucial.
Because it's not always obvious, right? Especially if you're struggling with these things, it can be hard to see the forest for the trees.
It's true. And recognizing those warning signs, both in yourself and in others, it's a huge first step towards getting help.
Absolutely.
And the good news is that there is effective help out there, whether it's therapy, medication, support groups, or a combination of those things. There are ways to break free from this cycle and really start living a fuller life.
That's such an important message. So, to everyone listening out there, if you relate to any of this, if you're struggling with OCD, with alcohol use, or both, please know that you are not alone. And reaching out for help, whether it's talking to a therapist, a trusted friend or family member, or even just doing your own research online, that can be that first courageous step toward healing.
I love that. Seeking help is a sign of strength, not weakness.
And knowledge is power. The more we understand about these conditions, the better equipped we are to support ourselves and each other on that path to recovery.
Couldn't have said it better myself.
This has been a really insightful conversation. We've covered a lot of ground here today. We talked about the prevalence of this connection between OCD and alcohol use, the very real risks that are involved, and most importantly, the fact that treatment can make a world of difference.
It's been a pleasure talking about this with you today.
Absolutely. And to everyone listening, thank you for joining us on this deep dive. We hope you found this information helpful. And remember, you are not defined by these conditions. There is hope and there is help available.